Your doctor tells you your liver blood tests are normal, your ALT is normal, your AST is normal, so you assume your liver is fine. But normal liver enzymes do not always mean a normal liver. That is one of the most important things I want my patients to understand about fatty liver disease. I recently saw a patient whose ALT was 32. In most labs, that would be considered normal. But when we looked deeper, the patient had a significant amount of fat in the liver and even early scarring. The routine liver enzyme tests did not tell the full story. I'm Dr. Kethu. I'm a board certified gastroenterologist and liver specialist and a former faculty at Brown University Medical School. I spend a lot of time helping patients understand what their routine labs are really showing and what they may be missing. In this video, I want to explain why ALT and AST can be normal even when fatty liver is present. And more importantly, I want to show you two numbers that may give you a better sense of whether your liver needs a closer look or any evaluation. The first number is your platelet count. The second is your FIB-4 score. These are not exotic tests. They usually come from routine blood work you may already have. But many patients are never taught how to interpret them in the context of fatty liver disease. First, let's talk about why ALT can be misleading. ALT is an enzyme found inside liver cells. When liver cells are injured or die, ALT can leak into the bloodstream. That is why a high ALT may suggest liver injury. But in early fatty liver disease, the liver cells may not be dying yet. They may be swollen with fat. They may be inflamed. They may be under metabolic stress. But if they are not leaking enough ALT into the blood, your ALT can still look normal. So a normal ALT does not always rule out fatty liver. It also does not reliably rule out early fibrosis or scarring. That is what I call the normal lab trap. The lab result looks reassuring, but the liver may still need evaluation, especially if you have risk factors like belly fat, pre-diabetes, diabetes, high triglycerides, sleep apnea, or a family history of metabolic disease. So what else should you look at? The first number is your platelet count. Most people think of platelets only as blood clotting cells, and that is one of their main jobs. But as a liver specialist, I also look at platelet count as a possible clue to your liver scarring. Here is why. When the liver becomes scarred, it can become stiff. That stiffness can increase pressure in the blood vessels that flow through the liver. Over time, this can affect the spleen and cause platelets to become trapped in the spleen. As a result, the platelet count may start to go down. This does not mean every low platelet count is from liver disease. There are many other causes of low platelets, what we call thrombocytopenia. But in the right context, a falling platelet count can be an important clue. In my clinic, if I see platelets trending down toward 200,000, especially in someone with fatty liver risk factors, I pay attention. If the platelet count is below 150,000, that becomes even more concerning and usually deserves a more careful liver evaluation. Again, this is not a diagnosis by itself. It is just a clue. But it is a clue that should not be ignored. So if you have access to your blood work, look at your CBC, complete blood count. Find the platelet count. Do not just look at whether it is technically in the normal range, because even the trend is what is important. Look at the trend. Was it 260,000 a few years ago, now 220,000, now then 185,000? The trend is more important than a single number. The second number is your FIB-4 score. FIB-4 is not a separate blood test. It is a calculation. It uses 4 pieces of information: your age, AST, ALT, and your platelet count. The reason FIB-4 score is useful is that it helps estimate the risk of advanced fibrosis or liver scarring. It is not perfect. It does not replace a liver specialist. It does not replace elastography, a scan sometimes we do to find out how much scar tissue you have in the liver. But it is a very useful screening tool because it uses numbers that are already available in your routine blood test results. In general, a FIB-4 score below 1.3 suggests a lower risk of advanced scarring or fibrosis. A score between 1.3 and 2.67 is an intermediate zone where further evaluation may be needed. A score above 2.67 raises more concern for advanced fibrosis and usually needs additional testing or referral to a liver specialist. This is why FIB-4 can be so helpful. Someone can have ALT and AST that do not look very alarming, but when you combine age, AST, ALT and platelets, the overall pattern may show higher fibrosis risk. That is the information you do not get by looking at just ALT alone. So here is the practical action plan. Step 1. Pull up your most recent blood work. You need your AST, ALT, platelet count and your age. These are usually found on a complete metabolic panel and complete blood count. Step 2. Use an online FIB-4 calculator. Enter those numbers and write down your score. Step 3. If your FIB-4 is above 1.3, do not panic, but consult with your doctor. You can say, my FIB-4 score is above 1.3 because of my risk factors. Do I need further evaluation for fatty liver or fibrosis, such as liver ultrasound or even fibroscan, which is elastography? That is a reasonable and medically appropriate question. If your score is above 2.67, then it is more concerning for advanced fibrosis or scarring. Now, step 4, look at the full picture. Do you have increased waist circumference, prediabetes or diabetes, high triglycerides, low HDL, sleep apnea, high blood pressure, a family history of diabetes or fatty liver? If yes, normal ALT alone should not be the end of the discussion. Now, one important point. If your FIB-4 is low, that is reassuring for advanced scarring, but it does not necessarily mean you have no liver fat. FIB-4 is mainly a fibrosis risk tool. It helps us estimate how much scar tissue you have. It does not measure liver fat directly. For liver fat, doctors may use simple ultrasound or fibroscan with CAP score, MRI-based tests or other imaging depending on the situation. The good news is that fatty liver is often reversible in the early stages. The liver has an amazing ability to heal when the underlying metabolic stress improves. Weight loss, regular exercise, improving insulin resistance, reducing sugar and refined carbohydrates, lowering triglycerides, treating sleep apnea and improving muscle mass can all make a meaningful difference. Even modest weight loss can reduce liver fat. Greater weight loss can improve inflammation and fibrosis risk in many patients. So the point of this video is not to scare you. It is to help you ask better questions. Normal ALT and AST are useful, but they are not the whole story. If you have fatty liver risk factors, check your platelet count trend, calculate your FIB-4 score, and ask whether you need liver imaging or fibroscan. Your routine labs may already contain important clues. You just need to know where to look. If this video helped you, subscribe for more evidence-based videos on fatty liver, gut health, and metabolic health. In my next video, I will explain how to read your liver lab tests more accurately, including ALT, AST, alkaline phosphatase, bilirubin, albumin, and platelets. I'm Dr. Kethu. I will see you in the next video. Thank you.